First of all, let us see what is meningitis. We know the brain's meninges, the coverings. Okay, this is the brain, this is skull, bone of skull, dura mater, epidural space, subdural space, arachnoid matter, this arachnoid matter, and this is pia mater, and this is a brain tissue. Now exactly what is meningitis? It's inflammation of the pia mater and the arachnoid matter. Okay, this is inflamed, and we know that subarachnoid space contains blood. It contains what? CSF, as well as this contains blood vessels. And okay, so this is subarachnoid space. This is arachnoid matter, subarachnoid space, and these are the sinuses. CSF is produced from blood and is returned to the blood. CSF passes from the subarachnoid space to the dural sinuses via the arachnoid villi. Okay. Now let us imagine that we are in the subarachnoid space. CSF is flowing there around the brain and the spinal cord. It is cushioning these important organs. Now we have to imagine that this delicate space is becoming inflamed, and that is meningitis. This particular space is becoming inflamed. There is swelling in this place, and that is nothing but meningitis. Particularly pia mater and arachnoid matter along with CSF in subarachnoid space, there is inflammation. Okay. Now the basic concept is clear. Let's see what the inflammation mainly affects the leptomeninges, CSF, and what is actually happening. There will be the pathogen. Trigger will be there. Trigger like immune trigger will be there. Then the pathogen will reach the bloodstream. It will cross the blood-brain barrier. The problem is at the blood-brain barrier also. Blood-brain barrier is nothing but the blood vessels of the brain and the spinal cord. Their endothelium becomes very tight, and it is normally very tight. That does not let the blood contents get out of the blood vessel except oxygen and CSF. But in case of this meningitis, in case where blood-brain barrier is not very healthy, in those cases, other cells and pathogens, they invade the CSF, the subarachnoid space. Let us watch a video regarding that.
For years, brain cells have been life blood vessels known as the blood-brain barrier. All blood vessels are lined with endothelial cells. There are gaps to let molecules out of the blood vessel into other tissues. But the endothelial cells that line brain blood vessels are really close together. That means only certain molecules can slip through and get out into the brain tissue. Some molecules, like water and oxygen, can cross the blood vessel wall and get into the brain. So can some fat soluble substances like caffeine and alcohol. Other molecules of the brain, like glucose, can hitchhike into the brain tissue with the help of certain proteins. But by and large, the blood-brain barrier doesn't let molecules through, which presents a big problem in medicine. That's why nutrition is measured as well for neurological conditions like Alzheimer's, stroke, and brain cancer.
Now that we have known what exactly the blood-brain barrier is, let us again reach the bloodstream where pathogen has reached, and it will cross the blood-brain barrier and it will enter CSF. It will cause inflammation. The result will be increased pressure, irritation of nerves, altered brain function. And why symptoms occur? Let us see. Symptom like headache will occur due to meningeal irritation, neck stiffness due to reflex muscle spasm. Now since there is huge pressure in the brain due to meningitis, neck stiffness will occur because of the muscle spasm, the reflex muscle spasm. And fever will be due to inflammation, photophobia due to the cranial nerve irritation due to inflammation. Now let's see the types of meningitis: infectious, non-infectious, infectious due to bacteria, virus, and TB, fungal. Okay, bacterial is severe emergency condition, viral is milder aseptic condition. There's no bacterial involvement and no pus, not much damage to the tissue, no neutrophils, so it's aseptic. And non-infectious due to drugs like sulfonamides. Then the monoclonal antibodies, they will do hypersensitivity reaction, they will activate the cell-mediated response, and they will cause meningitis. Autoimmune like Sjogren's syndrome, SLE, malignancy, neoplasm will also activate the immune response and hence cause meningitis. In malignancy, what happens? The tumor cells, they irritate the meningeal layers. I think I'll have to confirm it. Wait, I'll do that. Then we go to the clinical core idea that even mild swelling, it will increase. That will be increasing. ICP, dangerous if untreated, and neck stiffness, meningitis. CSF analysis is diagnosis key, and viral is usually self-limited, and bacterial is emergency. Now we have to see the viral. No, let's wait and then start with viral. Let's do it. Now let's see what is viral CNS infections. Let's see. First of all, we have to see the aseptic viral meningitis. Now, no bacterium gram stain or culture. That's why it's called aseptic. Like there's no infection. Usually it's viral etiology, causative organism is virus. Lymphocyte predominance is there. You are in the subarachnoid space where CSF is flowing quietly, and suddenly viruses enter. There is no pus, no neutrophil storm, just a lymphocytic aseptic inflammation is there, and that is nothing but aseptic viral meningitis. Place of action, flow of disease. That is the entry of virus it can be via respiratory tract or GI. Now, viremia, the virus will travel in blood. It will reach choroid plexus or cerebral capillaries. Then it will cross the blood-brain barrier and it will get into the CSF. There will be meningeal irritation, mild inflammation, immune response. There will be no pus formation as an immune response. There will be lymphocytic dominance. Now, etiology, let us see, due to enterovirus, which is most common. Then it can be due to herpes virus, and it can also be due to other viruses. Enteroviruses, they include Coxsackie A and B viruses. Coxsackie is a case in New York. Echinovirus, poliovirus. They account for 85% cases of the aseptic viral meningitis. Herpes virus, herpes simplex virus, and varicella zoster virus. This HSV2, it is common cause in adults, and mumps, HIV, early infection, arbovirus, they can also cause meningitis. Now, why is it called aseptic? What's the meaning of aseptic is without bacterial infection. So, if it is causing without bacterial infections, no bacteria isolated, no neutrophilic pus, and the culture is sterile, but not always viral. It can be TB, fungi, due to drugs, but exam focus will only focus the viral aseptic meningitis. But aseptic meningitis can also be due to TB, fungi, or drugs. Now, the CSF findings that will be seen are opening pressure in the CSF, in the subarachnoid space. It will be either normal or mildly increased. The cells in the CSF there will be increased lymphocyte count, that is pleocytosis. Proteins will be increased, glucose will be normal. Now, whenever we will see a lymphocytic pleocytosis with normal glucose concentration, it will be viral meningitis. Now, let's see the why and hows of this condition. The clinical features of viral meningitis are mild, fever, headache, neck stiffness, photophobia. But patient is conscious and less toxic. There is no severe brain edema like that in bacterial meningitis. The diagnosis that we will be seeing through CSF analysis, which rules out bacterial meningitis. PCR is a confirmatory test that detects the viral DNA, RNA, especially for enterovirus and the herpes simplex virus. Serology is rarely used. The treatment is mostly supportive and not an antibiotic is given. Supportive treatment includes fluids, antibiotics, and rest. If herpes simplex virus is suspected, acyclovir is given. Acyclovir, it does not let this virus replicate. So, and one more thing, that the viral meningitis is mostly self-limiting. Now let us see what's the difference between viral and bacterial meningitis. The cells in CSF are lymphocytes here, neutrophils here. No, glucose concentration is normal. Glucose levels are less reduced in bacterial inflammation. In bacterial meningitis, why? Because when bacterial pathogen will invade the CSF, it will consume the glucose. Because bacteria are more metabolically active, they will consume the glucose in the CSF, and hence they will decrease the glucose. But viruses, they do not. They activate the cell-mediated immunity, and hence they increase the lymphocytes level, and hence they do not consume glucose. So the glucose levels remain normal. Now the severity of viral meningitis is mild, whereas bacterial is severe, and the treatment is supportive and antibiotic supplement. Now let us see a young patient comes with fever, headache, mild neck stiffness, and he's fully conscious, and the lymphocytes level are increased in the CSF. Glucose is normal, and we think of enteroviral aseptic meningitis. We know why glucose is normal in viral meningitis but low in bacterial. The most common cause of aseptic meningitis is enteroviruses. Enteroviruses they are genus from the Picornaviridae family. They have RNA viruses. Okay, they're single-stranded linear icosahedral. They have 12 vertices, 20 facets, and they do not have an envelope. And they include entero, rhino, herpetoviruses. Okay. The next thing to be seen is what is the role of PCR. PCR will detect the RNA in the viruses. Viral lymphocytes dominate instead of neutrophils. The answer to this is that immune system is activated. And the viruses, they are intracellular pathogens. They activate the cell-mediated immunity. So lymphocytes, T cells, are dominated. Neutrophils, they are mainly for the extracellular bacterial infections. There's a cell, a bacteria will come, and it will do this pathogenesis. But when a virus comes, it invades the cell, and then it causes the cell-mediated immunity. So viral infections induce lymphocytic response due to the cell-mediated immunity. Okay. Now, acyclovir, we have seen, it breaks the DNA chain of virus. Virus building a DNA chain, it will be broken, and the virus won't be able to replicate, and infection is controlled due to acyclovir. Okay. Now, what is an opening pressure? It's pressure of CSF measured immediately after entering the subcategory space during lumbar function. Measured by manometer, it reflects the ICP at that particular moment. If high pressure is there, then CSF shoots up fast. But if normal pressure is there, CSF drips slowly. Normal value is 70 to 80 mm of H2O in adult. And we have to remember this value, mmH2O, 70 to 180. And in viral meningitis, we have to understand that opening pressure is normal or mild increase. Why only mild increase is there? Because there is no pus, no severe edema, no major blockage of CSF flow. If pus would have been there, if severe edema would have been there, if major blockage would have been there, then the opening pressure would have been more. The CSF would have shot out fast. Okay. And we have to see why the plasma protein is increased in viral meningitis, because the blood-brain barrier becomes leaky. Normally, the blood-brain barrier is very tight in the brain, but in the brain's blood vessels, but now it has become leaky, and the plasma proteins, they can leak into the CSF. So there's an increase in the plasma protein. But in bacterial meningitis, the protein is markedly increased because blood-brain barrier is severely disrupted. There is severe inflammation, neutrophils, pus, and the tissue, and there is also tissue damage. Okay. Now, but in viral meningitis, we see there is just mild things. Mild BBB is leaky, so mild increase in plasma proteins. Yeah, that's very little about aseptic viral meningitis. Next, we have to see poliomyelitis and stuff, all of that. Let's talk here for now.